General signs of drug abuse can be observed by the following. Admissions by employee or family. Only take what you hear from employee or close family member into consideration. You don't want a disgruntled coworker starting rumors or an angry ex-wife or ex-husband starting trouble. Possession of drug or drug paraphernalia. This could be anything from an elaborate bong to a light bulb or crushed Coke can fashioned into a pipe. An attitude that defends drug usage. Use of terminology language. May start using words in different texts to hide the true meaning of their conversation. In other words, Mary, Snow, Angel. Possession of pro-drug articles or literature. There are many books and magazines on drugs, and while it is not illegal to own such literature, it may be for actual use. For example, a book about how to grow pot, marijuana. Low self-esteem. Looks for acceptance from dealers who act as friends in order to get them to buy more drugs. Inattention to dress or personal hygiene. Once a clean-cut, sharp dresser, now they do not care what they look like or what they wear. Increased level of accidents, either on or off the job, due to their altered perception. It's been proven that drug abusers have 4 to 5 times more accidents than clean coworkers. Increased health problems. Increased tardiness, usually after payday, weekends, or holidays. Unable to get up on time after an all-night binge. Increased use of medical or other leaves. Theft, due to financial problems that often ensue after prolonged drug use while trying to maintain bills and drug habit. Unlawful actions. General indicators of drug abuse review. Question 1. Should you, as a supervisor, act upon information from other employees or family members about someone's possible substance abuse? Answer: no. Further investigation is necessary before action is taken. Question 2. Could low self-esteem be a sign of substance abuse? Answer: yes. Question 3. How many times are substance abusers more likely to have accidents in the workplace? Answer: 4 to 5 times greater. Question 4. List 3 or more indicators of substance abuse. Answer: possession of pro-drug articles or literature, an attitude that defends drug usage, use of drug terminology, language, inattention to dress or personal hygiene, increased health problems, increased tardiness, increased use of medical or other leaves, theft or unlawful acts. The indicators for alcohol misuse are more common and sometimes easier to detect than drugs. Odor on breath and body. Frequent use of breath mints or fresheners. Often people chew on parsley to get rid of the odor. Blurred speech, thick tongue syndrome. Glazed eyes and difficulty in focusing. Flushed skin. Alcohol will dilate the blood vessels, causing them to break, sometimes resulting in a red nose. In other words, W.C. Fields. Lack of coordination or balance. Unexplained bruising or accidents. Unwilling to tell what happened because they don't want anyone to know, or sometimes they may not remember due to a blackout. Availability and consumption of alcohol becomes the focus of social or professional activities. Very important to keep in mind. These are only indicators, do not constitute proof. Many of these symptoms are common to medical problems. Indicators of substance abuse are generally found over a period of time. A supervisor should try to establish a pattern, trend, or combination of many of the indicators. For alcohol misuse, the impairment or intoxication can usually be determined on a more incident-specific basis. Indicators of alcohol misuse review. Question 1. List 3 or more indicators of alcohol misuse. Answer. Odor on breath and/or body. Slurred speech. Glazed eyes. Flushed skin. Lack of coordination or balance. Unexplained bruising or accidents. Or availability of alcohol at parties. Question 2. Why are the above considered only as indicators and not proof of alcohol misuse? Answer. There may be a valid medical reason. Question 3. How are the indicators of alcohol misuse compared to drug abuse different? Answer. Alcohol misuse, for the most part, can be recognized on incident-by-incident basis, where drug abuse is over a longer period of time. Intervention is never easy with any problem, be it financial, marital, or drug alcohol abuse. However, it is easier if dealt with early. You must take action. A supervisor should make sure the employee is informed about and understands the level of performance that is expected, as well as the attendance policies. He or she needs to know and understand their rights, responsibilities, and what will happen if they don't improve. Be alert and look for indicators. A study showed that 10% of the workforce is abusing drugs and 5% of the population abuses alcohol. Discuss situations with the employee, focusing on performance. Let them know their performance level has started to decline. Do not discuss drugs or alcohol with them. Document any incidents of declining job performance. Document good performance as well as bad performance. Report to your supervisor if necessary. However, it is very critical that you do not discuss this with anyone who does not need to know. Make sure the person is trustworthy and will keep your confidence. You do not need rumors going around about who is abusing drugs. Stress and prioritize production, safety, and protection of property, and why the drug and alcohol policy is in place. Keep the information confidential. Be impartial, be objective, step back, and take a look at the whole picture. Have a list of referrals available and urge the employee to get help. If you do not have referrals on hand, you are not helping the matter. Watch for signs of reoccurrence if the employee has already been through rehab. Inform the employee that a request for a drug or alcohol test is not an accusation. Inform the employee of the consequences of a refusal. DOT states that a refusal is automatically construed as a positive. Actions to avoid. A supervisor should not accuse the employee or try to find out what is wrong. Do not accuse or try to diagnose. Focus on safety, performance, and productivity. Get involved in the employee's personal life or be misled by sympathy-evoking tactics. Break down or allow an employee to intimidate in order to invoke sympathy. Mention drug or alcohol abuse directly. Ignore performance or conduct indicators. Do not stick your head in the sand and hope it goes away. It never does. Overreact. Maintain your cool, be impartial, and stay calm no matter what. Be protective or try to shield the employee from consequences. Discuss suspicions with others. If you feel you must discuss it with someone, establish a trustworthy network. Describe the situation, but do not name the employee. Let the network be your sounding board. Show favoritism. Moralize by saying, "You know it's wrong, why do you do it?" Or, "I didn't agree with it when I was younger, and I still don't." Touch the employee. It could be the first step in a situation getting out of hand. A physical confrontation should always be avoided. Make plans. Documentation is the most critical component of an effective program. Good documentation should include complete and accurate details. Who, what, when, where, why, and how. Weather and traffic conditions. Other involved individuals. All relevant discussions. Date and time of incident. Summary and comments. Signature of employee. Intervention review. Question 1. On average, what percentage of the workforce abuses drugs? Answer: 10%. Question 2. On average, what percentage of the workforce misuses alcohol? Answer: 5%. Question 3. Why is it important to intervene early in substance abuse cases? Answer: the problem will not go away by itself. The earlier, the better. Question 4. What are 3 or more of the actions to avoid? Answers. Accuse the employee. Get involved in the employee's personal life. Allow an employee to intimidate you. Mention drug or alcohol abuse directly. Overreact. Discuss suspicions with others. Show favoritism. Moralize the issue. Or touch the employee. Question 5. What are 3 or more of good documentations? Answers. Complete and accurate details. Who, what, when, where, why, how, weather and traffic conditions, other involved individuals, all relevant discussions, summary and comments, and signature of employee. Alcohol. Alcohol abuse is a pattern of problem drinking that results in health consequences, social problems, or both. Alcohol dependence or alcoholism refers to a disease that is characterized by abnormal alcohol-seeking behavior that leads to an impaired control over drinking. Common street names: wine, beer, lager, cider, sherry, martini, gin, vodka, whiskey, and drink or booze. How they are taken. Alcohol is taken orally, in drink, or by absorption into an edible product. When consumed, alcohol is a depressant drug. Effects. Alcohol slows down the nervous system, reactions, and bodily functions. One becomes less inhibited, more relaxed, and sometimes aggressive. Dizziness, giggling, tiredness, and loss of concentration are all characteristics of excessive use of alcohol. Light drinking in adults, 1 to 3 units a day, is unlikely to damage health. For women, the recommended sensible level is 14 units or less per week. For men, 21 units or less per week. Over 3 units per day increase the risk of health and social problems. 1 unit is equivalent to 1 glass of wine, 1 ounce of 100 proof liquor, or a 12-ounce can of beer. Risks. Too much alcohol at one time can slow your body down to the point where it stops working altogether. Many fatal overdoses with drugs such as heroin and tranquilizers happen when people have been boozing. Taking more than 1 drug at a time is often dangerous and unpredictable. Alcohol is one of the worst mixers. How do I know if someone has a drinking problem? Inability to control drinking regardless of what you decide, you frequently wind up drunk. Blackouts, sometimes not remembering what happened while drinking. Using alcohol to escape problems. Concern shown by family and friends about drinking. Visual hallucinations and severe mood swings. Problems at work or in school as a result of drinking. A change in personality, turning from Dr. Jekyll to Mr. Hyde. Prolonged heavy use can result in loss of appetite, liver damage, nervousness, vitamin deficiencies, sexual impotence, memory loss, stomach ailments, liver, lung, and kidney impairment, skin problems, heart and central system damage, short-term effects, distorted vision, hearing and coordination, altered perceptions and emotions, impaired judgment, bad breath, hangovers. Alcohol review. Question 1. How many units a day is considered a health risk? Answer: 4 or more. Question 2. Alcohol is a blank drug. Answer: depressant. Question 3. List 2 or more of alcohol's short-term effects. Answer: distorted vision, hearing and coordination, altered perceptions and emotions, impaired judgment, bad breath, or hangover. Question 4. List 2 or more of alcohol's prolonged heavy use effects. Answers: loss of appetite, liver damage, nervousness, vitamin deficiencies, sexual impotence, memory loss, stomach ailments, lung and kidney impairment, skin problems, heart and central nervous system damage. To the central nervous system and are used to calm, induce sleep, or decrease anxiety. This drug is injected or swallowed in pill form. Tranquilizers depress the effectiveness of the central nervous system, which in turn slows the body down. There are 2 types of tranquilizers. Major tranquilizers. These tranquilizers are known as antipsychotics, which are used for the treatment of mental illness. Minor tranquilizers. These tranquilizers decrease anxiety as well as induce sleep. They also act as a general anesthetic. Common street names. Barbiturate names: Tuinal, Seconal, Nimbutal, Barbs, Downers, Blues, Reds, Sekis, sleeping pills, sleepers, Amitol, Cianol, goofballs, Christmas trees. Tranquilizer names: Valium, Librium, Ativan, Tranx, Downers, Benzos, Eggs, Jellies, Temazepam, Mogadon. How they are taken. Most barbiturates come in powdered form and are sold in colored capsules, which are swallowed. They are also available as ampules, suppositories, or syrup. Tranquilizers are usually available in pill form, but are sometimes injected. Effects. Both barbiturates and tranquilizers have similar effects of calming, sleep induction, and anxiety reduction. In small doses, barbiturates help people relax. Large doses produce a drunken effect, slurred speech, clumsiness, and unconsciousness. In small doses, tranquilizers can relieve anxiety, but higher doses can cause drowsiness and make people lethargic. There is a high risk of accidents when driving or operating machinery. Tranquilizers disrupt the psychomotor, intellectual, and perceptual functions. This drug accumulates in the body tissue after prolonged use. Normal dose is very close to a lethal dose. All are very dangerous when mixed with alcohol. The risks barbiturates. Barbiturates have many risks. Dependence can develop, and sudden withdrawal from high doses can result in death. Effects of withdrawal are irritability, nervousness, delirium, sleeplessness, fainting, sickness, and twitching and even fits. Overdose is an easy mistake caused by just a few extra tablets, as a normal dose is very close to a lethal dose. They are very dangerous when mixed with alcohol. The risks of tranquilizers. Tranquilizers also have many risks. Alertness is reduced and driving is affected. Tranquilizers release aggression and can cause convulsions. Takers quickly become dependent. When mixed with alcohol, it may cause a coma and death, and an overdose is a very real threat. Tolerance can develop quickly, so larger doses are needed to get the same effects. Withdrawal from regular use can lead to anxiety, nausea, and confusion. Side effects. Skin rashes. Increases in blood pressure, heart rate, breathing rate, and body temperature. Nausea. Heart attacks, strokes, and respiratory failure. Dizziness. Hepatitis or AIDS through shared needles. Brain seizures. Immediate effects appear rapidly and may last from hours to days. Reduce emotional reactions. Produce a floating sensation. Reduce feelings of anxiety. Reduce mental alertness. Slowing of heartbeat. Cause drowsiness. Reduce attention span. Shallow breathing. Cause mental confusion. Produce a sense of relaxation and well-being. Induce long periods of sleep. Cause physical unsteadiness. Long-term effects. Increased aggressiveness. Severe depression. Physical dependence. Tolerance and dependence. Withdrawal reactions. Increased tolerance. Tranquilizers and pregnancy. Possible congenital defects. Cleft lip. Cleft palate. Withdrawal symptoms can include tremors, stomach aches, irritability, agitation, disturbed sleep, sweating. Barbiturates and tranquilizers review. Question 1. Barbiturates and tranquilizers are blank drugs. Answer: depressant. Question 2. How are barbiturates and tranquilizers taken? Answer: swallowed or injected. Question 3. There is a risk of accident when blank or blank blank. Answer: driving or operating machinery. Question 4. Why is it extremely easy to overdose on barbiturates? Answer: a normal dose is very close to a lethal dose. Question 5. List 2 or more of the side effects of barbiturates and tranquilizers. Answers: skin rashes, increases in blood pressure, heart rate, breathing rate, and body temperature, nausea, heart attacks, strokes and respiratory failure, dizziness, hepatitis or AIDS through shared needles, or brain seizures. Question 6. List 3 or more of the immediate effects of barbiturates and tranquilizers. Answers: reduced emotional reactions, producing a floating sensation. Reduce feelings of anxiety. Reduce mental alertness. Slowing of heartbeat. Cause drowsiness. Reduce attention span. Shallow breathing. Cause mental confusion. Produce a sense of relaxation and well-being. Induce long periods of sleep. Or cause physical unsteadiness. Question 7. List 3 or more of the long-term effects of barbiturates and tranquilizers. Answer: increased aggressiveness, severe depression, physical dependence, tolerance and dependence, withdrawal reactions, or increased tolerance. Cocaine is a white powder that comes from the leaves of the South American coca plant. Cocaine is either snorted through the nasal passages or injected intravenously. Cocaine belongs to a class of drugs known as stimulants, which tend to give a temporary illusion of limitless power and energy that leave the user feeling depressed, edgy, and craving more. It's a smokable form of cocaine that has been chemically altered. Cocaine and crack are highly addictive. This addiction can erode physical and mental health and can become so strong that these drugs dominate all aspects of an addict's life. Street names: cocaine, crack, snow, Charlie, coke, rock, wash, stone. How they are taken. Cocaine is a commonly chopped up, divided into lines on a mirror, and then sniffed up through the nose through a tube. Crack is cocaine, which has been processed into small crystals about the size of raisins for smoking, which is known as freebasing. Occasionally, it is injected or processed into a form which can be smoked. Effects: a feeling of exhilaration, well-being, strength, and alertness and irritability, a sense of euphoria, reduces appetite, increases pulse rate and blood pressure. Effects tend to peak quickly and lessen rapidly. Takers can be hyperactive for 20 to 30 minutes. may have a runny nose and enlarged pupils. Effects soon replaced with anxiety and panic. There is an urge to repeat. Risks. Cocaine in any form is bad news for anyone with high blood pressure or a heart condition. Too much sniffing may damage the lining of the nose. Smoking can cause various breathing problems and pains in the chest. When someone stops regular use, they can feel very depressed and run down for some time. Those who carry on regularly can develop quite serious problems of anxiety and paranoia. It has to be taken often to maintain the high. Leading to high dependency levels also leads to sickness, sleeplessness, weight loss, convulsions, depression, and suicide. HIV, AIDS, and hepatitis are risks if sharing needles. Physical risks associated with using any amount of cocaine and crack. Increases in blood pressure, heart rate, breathing rate, and body temperature. Reduction of the body's ability to resist and combat infection. Heart attacks, strokes, and respiratory failure. Hepatitis or AIDS through shared needles. Brain seizures. Addicts are preoccupied with getting their drug, and most of their thoughts and behaviors are directed to that end. Cocaine interferes with judgment and produces exaggerated feelings of well-being and confidence in users. High doses can produce paranoia, and users can become aggressive and violent. Cocaine can produce death after first use or after prolonged use. Death occurs from cardiac arrest. The person's heart stops beating. Or seizures followed by respiratory arrest. The person stops breathing. Psychological risks. Violent, erratic, or paranoid behavior. Some users spend thousands of dollars on cocaine and crack each week and will do anything to support their habit. Many turn to drug selling, prostitution, or other crimes. Hallucinations and coke bugs, a sensation of imaginary insects crawling over the skin. Cocaine and crack use has been a contributing factor in a number of drownings, car crashes, falls, burns, and suicides. Confusion, anxiety, depression, and loss of interest in food or sex. Cocaine psychosis, losing touch with reality, loss of interest in friends, family, sports, hobbies, and other activities. Cocaine review. Question 1. Cocaine is a blank drug. Answer. Stimulant. Question 2. What geographical area does the majority of cocaine come from? Answer. South America. Question 3. How is cocaine taken? Answer. Snorted through the nose. Question 4. How long does the effects of cocaine last? Answer. 20 to 30 minutes. Question 5. What is one of the greatest risks of crack cocaine? Answer. Crack cocaine is extremely addictive, even after one use. PCP, phencyclidine, was originally developed as an anesthetic for humans and large animals. Use of PCP in humans was discontinued in 1965 because it was found that patients often became agitated, delusional, and irrational while recovering from its anesthetic effects. It is illegally manufactured in clandestine laboratories and is sold as tablets, capsules, and colored powders. How they are taken. PCP is a white crystalline powder that is readily soluble in water or alcohol. It has a distinct bitter chemical taste. PCP can be mixed easily with dyes and turns up on the illicit drug market in a variety of tablets, capsules, and colored powders. It is normally used in one of three ways: snorted, smoked, or eaten. For smoking, PCP is often applied to a leafy material such as mint, parsley, oregano, or marijuana. Common street names: angel dust, angel hair, mist, hog, crystal supergrass, killer joints, ozone, whack, rocket fuel. Effects. PCP produces feelings of invulnerability and a numbing effect on the mind that can often result in anger and rage. At high doses, there is a drop in blood pressure, pulse rate, and respiration. PCP can cause effects that mimic certain primary symptoms of schizophrenia. Physical risks associated with using PCP: increased heart rate and blood pressure, decreased awareness of touch and pain that can result in self-inflicted injuries, sleeplessness, tremors, convulsions, lack of muscular coordination, coma, heart and lung failure, sparse, mangled, and incoherent speech, double vision, catatonic syndrome whereby the user becomes mute, lethargic, disoriented, and makes meaningless, repetitive movements, confusion, suspicion, and loss of control. Having a bad psychological reaction to PCP and similar drugs is common. The scary sensation may last a few minutes or several hours, and may be mildly frightening or terrifying. The user may experience panic, confusion, suspiciousness, anxiety, feeling of helplessness, and loss of control. Sometimes taking a hallucinogen such as LSD can unmask mental or emotional problems that were previously unknown to the user. Flashbacks, in which the person experiences a drug's effects without having to take the drug again, can occur. Research has determined that PCP can protect the brain from permanent damage after a stroke or heart attack. Basic brain research on the actions of amino acids and the effects of commonly abused drugs led to the discovery that PCP can stop the uncontrolled activity that destroys nerve cells. This discovery is expected to help people who suffer from any trauma that interrupts the supply of oxygen to the brain. Researchers are now looking for drugs that can work like PCP without producing the psychological effects. PCP Review. Question 1. PCP was originally developed as an blank type of drug. Answer: anesthetic. Question 2. How is PCP taken? Answer: snorted, smoked, or eaten. Question 3. What are the effects of using PCP? Answer: feeling of invulnerability and has a numbing effect. Question 4. List 3 or more of the physical risks associated with using PCP. Answers: increased heart rate and blood pressure, decreased awareness of touch or pain, sleeplessness, tremors, convulsions, lack of muscular coordination, coma, heart-lung failure, sparse, mangled, and incoherent speech, double vision, catatonic syndrome, lethargic, disoriented, confusion, suspicion, or loss of control.